Ligaments are soft tissue structures that connect bone to bone. A sprain is defined as some level of disruption of one or more ligaments. With a low-grade sprain, the ligament is stretched. With a moderate sprain, there is a partial ligament tear. And with a severe sprain, there is a complete ligament tear. Sprains commonly occur along the outside of the ankle. This generally occurs when the foot twists or rolls at the ankle. A common location for sprains in the foot is the big toe joint. This injury is commonly referred to as turf toe and occurs when the big toe hyperextends. Sprains commonly occur with physical activity. They can occur with simple walking or running on an uneven surface. Sprains are common in such sports as soccer, lacrosse, basketball, and tennis. Other common causes of sprains include a simple fall, ligamentous laxity, inappropriate shoe gear including flip-flops, backless shoes, and barefoot walking, and a high arch foot type. Symptoms of sprains include pain and tenderness over the sprained ligament or ligaments, swelling, bruising also known as ecchymosis, joint pain and stiffness, difficulty walking or placing the foot on the ground, and gross instability or joint dislocation in a severe sprain. When treating sprains, the principles of RICE, which stands for rest, ice and immobilization, compression, and elevation, are followed. Rest includes avoiding activities that aggravates a sprain, such as exercise and excessive walking. Ice is generally applied for 20 minutes at a time, 2 to 3 times per day. The severity of the injury dictates the degree of immobilization required. Immobilization options include a cast and crutches, a walking boot, a hinged ankle-foot orthosis, and a multiligamentous lace-up ankle brace. Compression therapy generally is recommended with compression prescription stockings. Other treatments include avoidance of flip-flops, flats, and barefoot walking, early physical therapy to prevent joint stiffness, medications including anti-inflammatory medications, also known as NSAIDs, Tylenol, oral steroids, and in some cases narcotic pain medication. In severe sprains, surgical indications may be required. Sprains are soft tissue injuries and can commonly take longer than broken bones to heal. The severity of the sprain generally dictates the recovery time. With low-grade sprains, improvement is seen in about 3 to 6 weeks. With moderate sprains, healing takes about 6 to 8 weeks. Severe sprains can take anywhere from 3 to 6 months to improve. Early treatment of sprains is important to reduce the incidence of chronic pain, stiffness, and swelling, and to prevent chronic instability and re-injury. If you're experiencing any of these symptoms, please call the Timonium Foot and Ankle Center today to schedule an appointment.